We hear very many stories currently about people just unable to get the help they need in a crisis. And if you can't get help in a crisis, I think things go from bad to worse.
18 people were taken to police cells under 136 of the Mental Health Act over the last year. These are people who have mental health problems who are going to a police cell.
I hate to see people going through the criminal justice system simply because they're ill. It's wrong.
We just historically in this country have said it's okay if you have a mental health problem to have a worse provision of service than if you have a physical health problem. That attitude has to stop, and it has to stop straight away.
Too many people in crisis end up in the wrong service, such as A&E, wait for a long time to get access to services, and we need to improve that.
When I accessed crisis services, it was quite a traumatic experience. It seemed like the personal element, the fact that I'm a human being, a vulnerable human being, was overlooked, and that can't happen.
Too often what we do is we decide how we're going to deliver healthcare according to the needs of institutions or professional groups, rather than towards the needs of the service user.
I think it's lack of training, I think it's lack of resources, and I think it's a lack of recognising that the patient's voice is actually the most important aspect.
I think our services are just as much in crisis at the moment as our patients.
We're trying to help people build their own mental health and resilience so that they are less likely to fall into crisis.
People always have an opportunity to self-refer earlier in crisis, so they're not at the point where they're being picked up and taken somewhere. They're identifying themselves, they're on the way to a serious crisis.
What we need is that wherever you first turn up, whatever door you first come in, you should have a response that's competent, compassionate and quick.
This is about making sure that people in crisis with their mental health get seen and treated in the right place at the right time by the right person.
We need London to be absolutely clear that they are using every single possible national, international best practice technique.
Have a single point of access. We've just opened something we're calling a spa.
The crisis cafe model, for example in Surrey, has been seen as a very easy solution that provides the right support.
Small funding for small projects that actually really make a difference to people's lives.
Of course, money is important, and we know that mental health services have been starved of money, and there's no way around that. But a lot of this is about services working together.
London needs to work as a very large partnership between all the agencies that respond to crisis.
We can't have areas or sections of the NHS that are precious around geography, around their own budgets. We should be putting the patient first.
I know that people within London and within mental health crisis care are absolutely committed to working at it.
We've had a real drive for collaboration.
Everybody needs to be involved to do this.
The culture needs to be looking at people as a whole, and not just the person but also their family.
I do think that things are changing for the better. I'm hopeful.
I have a real optimism about how far we can push this agenda.
2016 has to be the year that we start seeing some fundamental changes on the front line.
What we need to do is make sure that we keep momentum, that we go forward and we start making some decisions together.
At the moment there is the most amazing opportunity.
If we want to make change, we need to do it.